Nasal polyps. Around 1% of the UK population have nasal polyps. They are more commonly seen in males as compared to female, children, and elderly people. Associations of nasal polyps is very important. It is associated with asthma, particularly late onset, aspirin sensitivity, infective sinusitis, cystic fibrosis, Carter syndrome, and Churg-Strauss syndrome. So there are two syndromes and four diseases: asthma, aspirin, and nasal polyp. The triad is known as Semter's triad. It is worth mentioning here the nasal polyps associated with infective sinusitis is bilateral. Coming to the features, it presents with nasal obstruction, rhinorrhea, and sneezing due to obstruction, and ultimately leading to the poor sense of taste and smell. It is important to note here the patient presenting with unilateral symptoms of obstruction or unilateral polyps are always red flag symptoms. They require further investigation to rule out underlying malignancy. Coming to management, all patients with nasal polyps warrant full ENT examination. For the medical management, topical steroids can be given and they are effective in 80% of the patient. They work by shrinking the polyp size.